Just imagine a simple, inexpensive blood test that could help predict your risk of autoimmune diseases, cancer, severe respiratory infections, even cognitive decline. And this simple test revealed whether or not you were getting enough of a crucial nutrient for your immune system, your metabolism, and your overall health. Would you be interested? Go ask your doctor for it, because they probably don't already do it. And if you do ask for it, you may actually get a little bit of pushback from your doctor. So let's talk about vitamin D. So before we get into too much talking about vitamin D, we should probably establish what normal levels are, right? So there's generally sort of 3 categories, but I would like to expand it a little bit. But in general, levels below 20 nanograms per milliliter are considered deficient, and then levels between 20 to 30 are considered insufficient, right? So there's a difference between deficient and insufficient. Insufficient quite isn't as bad as deficient. And then anything above 30 is considered normal. Now, that's kind of old school thinking about like musculoskeletal health and bone disease and rickets and things like that. But what most studies now are talking about, especially, and we'll talk about this in a second, is your immune system, very dependent on vitamin D levels. And most studies are now saying somewhere between 40 to 60 is probably optimal, with some conditions even requiring higher levels than that, which we will talk about in a second. Now, when it comes to the levels of vitamin D deficiency and insufficiency, the numbers are shocking. In fact, globally, about 50% of the people in the world are either insufficient or deficient with vitamin D. And in the United States, about 35 to 50% of adults are insufficient and 8% are deficient. And then certain groups like people with darker skin, older adults, people living in a northern latitude are disproportionately affected by this. Now, the relationship between vitamin D and COVID-19 outcomes is one of the most compelling examples of vitamin D's importance. And this is due to the massive influence that vitamin D has on the immune system. It's been known for many, many decades that vitamin D is important for things like bone health, but its role in the immune system is a relatively new thing. So before we get into COVID-19, let's just take a quick peek at vitamin D's role on the immune system. So we can see here in this diagram from this paper that vitamin D influences the innate immune system, which is the immune system that we're born with, but it also has a huge influence on the adaptive immune system. Now, the adaptive immune system is the part of the immune system that learns. In other words, when you're exposed to certain antigens, the body develops certain antibodies and memory B cells and memory T cells, which makes it really important for not only things like chickenpox, but also COVID-19 and, more importantly, autoimmune conditions, which we'll see later in this video. Now, when it came to COVID-19, vitamin D was not only helpful in helping resolve the infection if you took it as a supplement, but also vitamin D deficiencies left people much more vulnerable to infection and making the illness more severe. In fact, one particular study on people who are already hospitalized for COVID-19, so these were people in rough shape already, the people with vitamin D levels below 30 nanograms per milliliter experienced a 25% mortality rate compared to those with 9.2% mortality rate in the people who had sufficient levels of vitamin D. Another study looking at hospitalized patients for COVID-19 found that if their vitamin D level was below 20 nanograms per milliliter, they were 14 times more likely to have their COVID-19 turn into severe or critical condition compared to those whose vitamin D levels were above 40 nanograms per milliliter. That's not 14% more, that's 14 times more. Another paper found that critically ill COVID-19 patients with vitamin D levels very low, like less than 10 nanograms per milliliter, had a 71% mortality rate compared with only 31% mortality rate above 10 nanograms per milliliter, which is still really, really low. But if you're below 10, 71% mortality rate over 60 days. And if you were above 10, 31% mortality rate. But overall, they had a 5.6-fold higher risk of death. Now, back in the day, you may have heard this term cytokine storm back in the day, like a few years ago during COVID. But vitamin D, it really modulates your immune system, right? It modulates inflammatory markers like interleukin-6 and TNF-alpha, which we don't need to get into, but they're part of this cytokine storm, this inflammatory process that was really associated with a lot of death during COVID days. So all of that is just talking about, okay, well, that's associated with low vitamin D levels, had a much poorer outcome for COVID-19. What if you gave people vitamin D? Well, this paper by Castillo said COVID-19 patients receiving calcifediol had 80% reduced risk of ICU admissions. 80% reduced risk of ICU admissions when they were given calcifediol, which is a form of vitamin D, which we'll talk about in a second. It's not the oral form that you take, but it's a different kind, but we'll talk about it in a second. So I won't bore you with too many of these, but another study looked at 537 hospitalized patients for COVID-19 and found that patients receiving calcifediol had significantly lower in-hospital mortality rate of 5% versus 20% in-hospital mortality rate for those who were not receiving calcifediol, or that form of vitamin D. And so that means the adjusted odds ratio for the mortality was 0.16. So in other words, it's an 84% reduction in death rate in the hospital if they were given that form of vitamin D. But it's not just COVID. It's a whole slew of different things. So let's take a look at a few of them. First, we'll start with autoimmune diseases, which is a massive impact of vitamin D on autoimmune diseases. So deficiency of vitamin D increases the risk of diseases like rheumatoid arthritis, lupus, and multiple sclerosis. And then we see studies that use supplementation of vitamin D helping protect against the onset of autoimmune diseases. For example, this paper in the British Medical Journal in 2022 followed almost 26,000 people and found that vitamin D supplementation for 5 years reduced autoimmune diseases by 22%. And then we can see this paper published in Neurology that followed almost 200,000 women and found that those who supplemented with at least 400 IUs of vitamin D per day, which really isn't very much, had a 40% reduction in multiple sclerosis compared to the women who weren't supplementing. When it comes to cancer, this huge meta-analysis of 35 studies found that higher vitamin D levels were associated with lower cancer risk by reducing it by 20%, and then also reducing cancer mortality by 33%. When it comes to respiratory illnesses like COVID-19, vitamin D deficiency raises the risk of respiratory infections by 60%. Just getting the infection, it raises your risk of getting an infection, while supplementation improves outcomes. Now, a lot of that is simply because vitamin D really reduces your inflammatory pathways. It reduces cytokines like interleukin-6, TNF-alpha, C-reactive protein, and other inflammatory cytokines. So another aspect that vitamin D can help is just cognitive function and neurodegenerative diseases. Higher vitamin D levels are associated with better cognitive function and reduced risk of conditions like Alzheimer's disease. So just as a quick example of that, this paper reported that vitamin D deficiency, as defined by less than 10 nanograms per milliliter, was associated with a 79% increased risk of dementia. And moreover than that, they say that if you supplement and raise your rates to a paltry amount of 20 nanograms per milliliter, you could prevent about 17% of the cases of dementia. So here's another paper published in the journal Neurology, and they said, again, this level of really low vitamin D of less than 10 nanograms per milliliter was associated with a 2.25-fold increase in the risk of all-cause dementia, which is a 125% increase, and a 2.2-fold increased risk of Alzheimer's disease. So why are so many people deficient in vitamin D, right? Well, there's a few different reasons. First of all, just environmental and lifestyle factors, right? If you live at a higher latitude, you're gonna have less sun exposure. And if you are exposed to the sun a lot, most people will typically cover up with clothing and hats and whatnot. They'll cover up with sunscreen, appropriately so. I'm not saying it's not appropriate. It's just one of the many reasons why we don't get enough vitamin D in our bodies. Another reason is even if you are exposed to the sun more, your body's going to compensate by producing more melanin, right? It's going to darken the color of your skin, which is going to reduce the amount of vitamin D that your body can make. But it's not just the environment and lifestyle factors, it's health conditions too, right? The way the body works is that, like, if you take vitamin D in as a supplement, that's not what your body uses. Your body will convert the vitamin D into something called calcifediol, and it does so in the liver, right? So when it does convert calcifediol in the liver and you have liver problems, you're going to have less vitamin D, right? But it doesn't end there. Once it converts to calcifediol, it also then has to go into another process to make calcitriol, which is the form of vitamin D that your body actually utilizes. And where does that conversion of calcifediol to calcitriol take place? In the kidneys. So if you have chronic kidney disease, you're probably going to have less of this calcitriol, which is the effective form of vitamin D. But even if you are taking vitamin D supplements, let's say you're taking a supplement and your levels aren't rising. Well, maybe you're not absorbing it. Certain conditions like Crohn's disease and ulcerative colitis will affect vitamin D absorption. But then vitamin D is also a fat-soluble vitamin. So a lot of studies show if you have gallbladder problems, which helps, digest fat and absorb fat. So if you have gallbladder dysfunction, or if you've had bariatric surgery, or an ileostomy where you absorb a lot of your fat, you're probably not going to be absorbing the vitamin D properly. So I hope I've given you enough reason to get your vitamin D tested. Given the overwhelming evidence, testing vitamin D seems like a no-brainer. However, as I said, most doctors don't test for it, and if you go to your doctor and you ask for it, you might expect some pushback. So take this 2019 paper by Singer. They talk about pushing back on patients who ask for a vitamin D test. They're actually trying to dissuade patients from requesting vitamin D tests. They literally have scripts for doctors to follow to try to dissuade patients from wanting to get vitamin D tests. Now, if you get your vitamin D tested in my practice, which I do often, I do pretty much on everybody, guess how much it costs for a vitamin D test? $26. That's how much Quest charges. If you go there and you pay out of pocket because I've ordered it, it's $26. I don't think that's too cost prohibitive. And then the other reason that they push back against it is because, look, most people will get enough from sunshine anyway. I think we've already established that's not necessarily true. There is a huge deficiency and insufficiency with vitamin D. And then the next argument is, well, you just take supplements anyway, so everybody should just take supplements. But that's not true either, because there's a lot of people who, like we just talked about, they may not be absorbing it, they may not be converting it in their body to the efficient levels, but also if you're just really taking a lot of vitamin D, there are hazards of that too, right? You can get hypercalcemia, which means vitamin D really helps your body absorb calcium. So if you're taking too much, guess what? You have more risk of kidney stones, you have more risk of calcium deposits in your arteries and veins. So getting tested just makes sense, because there's this old saying, if you're not testing, you're guessing. So in summary, I hope I've established that vitamin D is more than just a nutrient. It's a critical factor for disease prevention and overall health, from reducing your risk of COVID-19 to lowering your risk of autoimmune diseases and cancer and many more. Maintaining optimal vitamin D levels can transform your health. Despite its importance, deficiency is very widespread, driven by factors like limited sun exposure, chronic health conditions that affect the absorption, and testing ensures that you know your levels that allow for safe and effective supplementation. So don't let outdated guidelines and cost concerns stop you. Ask your healthcare provider for a vitamin D test and take some control of your health.